Hello guys, I hope you're well. So today we're going through hypertension in terms of the Gphc exam. It's going to be a very short, concise video, straight to the point. This is something that you can watch before the exam, straight before, and now let's get it. So first point we want to go through is understanding that the main gist of the hypertension guidelines is understanding the first step. So when do you give ACE inhibitors or ARBs, or when do you give calcium channel blockers? So this is the first point to understand. And once you understand in your brain, the main point is to understand when you give an ACE or an ARB or a CCB, that will slowly allow you to understand what to give in the next step. So let's break it down, right? Hypertension treatment is basically ACE, ARB or CCB first line. So step 1. In the official guidelines, they've put it as Step 1, Step 2, Step 3, Step 4, and rather than step, think of line. So Step 1 means first line, Step 2 is second line, and Step 3 is third line, right? That's the first point. So if someone has hypertension with type 2 diabetes, ignoring race or age, think of its ACE or ARB, right? To give you a reference point, look here. I want you guys to look here. Hypertension with type 2 diabetes, no matter their age or race, is ACE or ARB, right? So when you go here into this tree, your first point is you have 3 no's. I like to call it triple no. Triple whammy, triple no, however you want to think about it. So not diabetic, not 55, and not African Caribbean. The triple no's, that's ACE or ARB, right? Now, second part would be no diabetes and over 55 of any ethnicity is amlodipine or some sort of dihydropyridine calcium channel blocker. Now, other one would be not diabetic, African Caribbean of any age, so irrespective of age. Now, I've wrote that here in my own way. So if someone is not diabetic, right, not 55, so under 55 years old, and not African Caribbean, so they could be Caucasian or any other ethnic group, then it's ACE or ARB. If someone is diabetic and 55 or over, irrespective of race, it's amlodipine or any other CCB, that's dihydropyridine. If someone is diabetic and African Caribbean of any age, then it's CCB as well, irrespective of age. Yeah, if that makes sense, guys. Rewind the video if that doesn't make sense, and that should explain that well. So let's look at hyperkalemic causing drugs, because ACE inhibitors are involved in that. So drugs that can cause hyperkalemia is the mnemonic FANXB, so trimethoprim, heparins, ACE inhibitors, NSAIDs, potassium-sparing diuretics like spironolactone, which is for chronic heart failure as well. So BAMs for chronic heart failure, and beta blockers, which can cause hyperkalemia. And my other slide is about not forgetting that your short-acting beta-2 agonists are used for moderate to severe hyperkalemia. So your salbutamol can cause hypokalemia, and your reference range for potassium is 3.5 to 5.3. And that's a very important point. You don't have to remember the reference range for your exam, but they'll give you it. And thank you so much, guys. And